Good afternoon, sir, my dear friends. Today we will be presenting a PowerPoint presentation on the topic euthanasia. Let's start. What is euthanasia first of all? Suppose euthanasia, or in common words you can also call it as mercy killing. Now, what is euthanasia actually? Suppose a person is suffering from illness from a long period, like an incurable disease, from which he is not able to cure himself, and the medical science is not able to relieve himself from that pain and suffering. We deliberately end that person's life in order to relieve him from that pain, so that he can die a peaceful death and he can be relieved from that pain. Now, we are relieving a person from that pain by killing himself, and killing someone is really a major thing. So, can we just do it like that? No, we cannot. There has to be some circumstances, some points, some things that we have to practice this and we have to kill someone. Now, what are those things? Criteria for practicing euthanasia. First point, the patient has to be competent and the request voluntary. Sir, competent and the request voluntary and intentional. That means the patient should himself say that yes, please kill me and relieve me of this pain. I'm not able to bear this anymore. Next point. The patient has to suffer unbearably. Means his illness should be such that he cannot bear it anymore and the medical science is not able to give him better treatment and cannot cure him. Next point. Euthanasia can be done only by a doctor. It's about killing someone or taking someone's life. So it should not be practiced by some common person, like just you will kill someone or like that. It should be properly done in a doctor's in doctor's supervision. Next point, euthanasia has to be the last choice. This point says that euthanasia should be taken at the worst stage when the person is not able to cure himself at the last point. Like not science, not medicines, not anything is able to cure him.
Even when the prayers does not.
Exactly, the prayers and medicines also are not able to work, then euthanasia should be practiced and death should be given to that person. From here, Rishabh will tell you.
Thank you, Rish. I would like to classify the euthanasia. It is classified into three types: voluntary, involuntary, and non-voluntary. The voluntary euthanasia consists of the killing of a person by his own permission. Let's take it. This is the voluntary euthanasia is legalized in Belgium and Netherlands. The euthanasia started from Netherlands in 1994. The voluntary euthanasia is further divided into two parts, that is active euthanasia and passive euthanasia. Active euthanasia entails the use of some types of drugs, medicines, or anything else which is.
You could have mentioned the name of such, the drugs that they inject into people. Could have. Fine. Go on.
So he can just die at that moment. But in the passive euthanasia, we just let the thing to die. Because wait for the day that he will die.
Common treatments. Matlab, by stopping the treatments altogether.
Yes, sir, but we just let it to die.
We don't do treatments.
We
stop treatments.
Stop it.
So you either inject something lethal or you stop the treatment of that ailing person. Fine. Yeah.
Now I said no campaign. Now let us talk about non-voluntary euthanasia and voluntary euthanasia. What is non-voluntary euthanasia?
Euthanasia.
Euthanasia. Euthanasia in which the consent of the patient cannot be taken. That type of euthanasia is known as non-voluntary. For example, let us consider a small newborn baby who cannot speak. So it is impossible to take the consent of that child. So if he or she is suffering from a severe disease or illness which cannot be cured, so the last choice is euthanasia. So in that case, that will be a non-voluntary euthanasia. Now, involuntary euthanasia, conducted against the will of the patient. That is in which the patient is not informed and without the consent of the patient, the patient is killed. It is also
just equal to murder.
Yes,
right.
Which is equal to murder. Now the other topics will be done by Rishabh.
Euthanasia would, first of all, I will tell some examples of that. Mumbai, there was a nurse who was brutally raped, and till last year, her name was Aruna. She was in that severe condition that she can't do her work with herself. She was totally dependent on machines, medical life support, and all that.
Right.
But the judgment passed that she was euthanasia cannot be practiced on her, and unfortunately she died not because of euthanasia.
But on the natural
Yes,
course of
on the-
things,
yes,
she
sir.
died. But she demanded euthanasia.
Yes, sir.
Okay.
But then
So
also
this is a case of somebody who is voluntarily willing to have
Yes.
or go through
But
euthanasia,
in India-
and that is being obstructed by the law,
Yes.
because that cannot be practiced according to law in India. Okay, fine. Yeah. For example.
Sir, and one more, there was in South India, Venkatesh, a person who was having a muscle disorderness, through
Disorder.
which,
Yeah. Disorder is practiced.
through which he totally become paralyzed, even if he cannot speak a word, and suffering from a severe pain in all of his body. But there was a social service in Sonali. She appealed to the government for the euthanasia, but as she was not in a relation, so the government cancelled her appeal and now also he was living such a painful life.
He is still living.
Yes.
So in one case the person ultimately dies.
Yes.
In the other case the person is
Still
still
living.
living and suffering.
Yes.
Fine. Go on.
Sir, physician. Sir, it's some facts by yes, sir. Physician-assisted suicide, if it becomes widespread, could become a profit-enhanced tools for big HMOs. Drugs used in assisted suicide cost only about $40, but it could take $40,000 to treat a patient properly, so that they don't want to choose, so they want to choose an assisted suicide.
Sir, in these slides, we're trying to describe that euthanasia should not be practiced and it should not be legalized because of some reasons. These are the reasons by which euthanasia should not be legalized and practiced.
Only in
Yeah, go on.
only in severe conditions, if the person is willing, then only we can do that, because it will give relief to the patient, and also the medicals, the expenses that government is bearing on that patient will also be reduced in some way.
Okay. So in conclusion, do you have a conclusion?
Conclusion: legalized euthanasia and assisted suicide leads to suicide contagion. Euthanasia is a rejection of importance and the value of human life.
So by this presentation, we come to the conclusion that euthanasia should not be legalized and it should not be practiced, because in euthanasia it can also become a means for other people to get their own private means, like someone who killed his father or gave him euthanasia just under the name of euthanasia to just acquire his property. And also a government would like say, why should I spend this much of money on this patient if a patient is submitted to a government hospital? So government will also say, just give him euthanasia, and so that our money can be saved for their own personal needs. So sir, by this presentation we come to the conclusion that euthanasia should be minimized and it should not be practiced as far as possible, except in
It should
the
be
case,
restricted, even if
except-
practiced, it should be restricted.
except in the adverse cases.
Most adverse
Most
cases,
adverse
as a last
cases.
resort.
Because we are doing this because of emotional attachment of the people,
Right.
not with the ethical, because science is ethically neutral.
Right.
We cannot be treat any person by emotions.
Right.
So that is the point, because of emotions we doing so.
So in other way, we can say we all are humans and we don't have right to take a life of other human as we
This is God laws, we cannot.
Right.
Need like God gave us, but He also no right to take our birth.
Very good point. Even the God doesn't have the right to take our lives. We are so invaluable. That's good, a good presentation. I will end your presentation with one question which you will think about. Isn't the responsibility of somebody's own life depend on that person? Isn't the responsibility of the choices makes that person an individual, unique person? Even I, as a patient, if I feel that I don't want to live anymore, I have lived 70 years of my life in full freedom. Now that I am there, let's say for 10 years on the hospital bed, and I have nothing to lose, nothing to gain, I want to die. So, I want to die. That is a voluntary euthanasia. So do you think in those cases, euthanasia should be
Sir,
granted.
in those cases,
Sir,
it should motivate the person that no, please live, not for you, but for others, for your family members.
If that person have no
So there's a hope, there's a
person-
will. There's a hope, there's a will. Make us happy, happy.
for a 70 or 90-year person, there is no hope and there is no
We cannot
will.
know what is the
If that
heartbeat
person
tomorrow.
says, so why would you like to motivate that person? We'll continue with question and answer in the next session. And thank you all. Thank you for